Like many words derived from Greek origin, the word meta is a Greek word with a double meaning. It means after, next step, so it's a sign of evolution, or it means leave it for later, like it's a non-typical Greek way of procrastination. I don't know how difficult it was to go from Facebook to metaverse, but I'm pretty sure for orthopedics, to become meta orthopedics, it's a path full of skepticism, changes, conservatism, and reactions. So what is meta orthopedics? It's a new aspect of orthopedics. Let's say it's a combination of the already existing heavy and strenuous surgeries with a lot of implants and metals, but also another part of this specialty, more poetic and artistic, much more biologically based, enriched with regenerative medicine procedures. Imagine a small piece of cartilage micrografts from the backside of the ear of the patient that can be injected into the knee that has cartilage problems. Imagine stem cells from fat or from bone marrow that can be used for tendons, cartilage, ligaments, and arthritic problems. Injections from your own blood are so useful for many inflammatory orthopedic conditions like shoulder or elbow problems. So you can see that there are so many possible applications with regenerative medicine. Of course, we need much more scientific backup. All my life, I'm following and combining my two passions, sports and medicine. I played basketball for 60 years in Greece, and then I became an orthopedic surgeon. Career ended after an injury I sustained to my knee, and the operation proceeded. I never played basketball again, and I still have knee problems. No, come on, it's not my age, please. It's not because of my age. I became an orthopedic surgeon, performing all the typical operations, but something was attracting me to less invasive procedures from the very beginning. So I specialized in arthroscopic surgery with emphasis on sports injuries. I also realized that I was really talented on this kind of operations with good surgical orientation and the capability to use arthroscopic tools with both my hands. And that's quite amazing because in real life, I can only use my left hand for scratching my back sometimes. So after 25 years of practicing orthopedics, arthroscopic surgery, and becoming head doctor in many professional sport clubs and elite athletes, I found a way to be professionally happy. And that is because I was practicing something surgically very challenging and constantly evolving. And on the same time, I combined my love for sports by being a high-level sports doctor. But then this small Greek word, meta, came in my mind, became the new, annoying, but also motivating force for my job and for my life. Meta, what is next? What is the next step? I realized that we should offer new options to our patients and to ourselves. As you're young and strong, you feel invincible. An injury could be devastating, and you want to come back as soon and as healthy as before. And as you are aging, you are missing your prime time, your glory days. You want to perform in an aspect of your life in the highest level. It's the same perspective, healthy, top-level performance. So the challenge to the orthopedic surgeon in the 21st century is the desire of the aging patient to remain physically and mentally active and to continue to contribute to society. And for the younger patients to participate in more physically demanding sporting activities resulting in injuries that require biological solutions, which can allow them to continue to be active through their lifetime. I was blessed to be capable to offer solutions for orthopedic and sport problems thanks to my surgical training. The missing link was what is the best option to offer to situations not demanding a surgical interference, but which were restrictive and painful enough to impair the quality of our patient's life. The answer for me so far is regenerative medicine, to repair and not to replace. By injecting or grafting biological agents, with strong regenerative capacity, like PRP, stem cells from adipose tissue or bone marrow, autologous cartilage micrografts. We can help with problems like arthritis for patients who are not ready for metal yet, cartilage, intervertebral discs, tendons, ligaments, problems, bone healing, etc. But as we age, our stem cells are also aging as well and become dysfunctional over time, causing tissues to deteriorate and increasing risk for disease. A big problem is that cells during their life reach a state that they are not dividing anymore, but they still remain alive. So they called zombie cells, and this situation is called cellular senescence. In order to rejuvenate stem cells, it seems that it's important to use senolytic supplements to fight senescence and to adapt a way of living with high-intensity interval exercise, with good sleep, spending time in the sun, cold showers, intermittent fasting, promoting good stress and a healthy epigenome without any DNA interference. Epigenome is the piano player, and genes are the keys. You cannot change the genes, you cannot change the keys. But by playing the piano, you can turn genes on and off, driving health issues to a good or a bad direction. Our way of living directly affects the state of our epigenome. So what does finally meta-orthopedics mean? A combination of classical orthopedic interventions with regenerative practices, with orthobiologics based on markers for cellular senescence and epigenome function. So the whole procedure, at least according to my opinion, should be like testing some aging markers, evaluating DNA and our biological age, and according to the results that we're going to use senolytic supplements, good nutrition, to have a good weight, to try to resolve problems like high cholesterol or high blood sugar or high blood pressure before harvesting stem cells. So we then go to the regenerative procedure. We're taking stem cells or cartilage progenitors, and we use them for the problems that we said before. And then we have a rehabilitation program which is custom-made, personalized for every patient. And then we make new tests in order to see what have we succeeded. This is going to be a new impressive era based on biological procedures for less invasive surgeries, regeneration, anti-aging, and longevity. I call you to search before you decide what you are going to do with your health problems. Seek the advice of your doctor about the possibility to safely use regenerative procedures. Just keep in mind, if it's possible, it's better to repair than to replace. Thank you.